So for question number 1, a 17-year-old boy complains of fever and painful swollen cheeks. He recently emigrated from Mexico, and one of his relatives had a similar illness a few weeks back. He cannot remember his vaccination status. He finds it hard to talk, eat, and swallow. He denies headache or neck pain. Which of the following findings might also be present on examination of this boy? Is it A, orchitis, B, splenomegaly, C, papilledema, D, peripheral edema, or E, a systolic ejection murmur? Take a minute to think about the question, and we'll go over it together in just a minute. The answer to this question is A. This boy has infection with the mumps virus. Mumps is an infectious disease that can cause swollen cheeks, as we are seeing in this patient. Although not often seen in the United States because of the MMR vaccine, mumps occasionally presents in those who have not been vaccinated, as in this child. Mumps is caused by an RNA paramyxovirus that replicates in the upper respiratory tract and causes parotitis. This patient most likely has parotitis, signified by the fever, painful and swollen cheeks. Mumps can also lead to an orchitis or inflammation of the testes. It can lead to pancreatitis and meningitis as well. Respiratory droplets and direct contact are its main forms of transmission. Treatment is usually supportive with some pain medication as well. Some infectious causes can include mononucleosis and viral hepatitis inside a megalovirus that lead to splenomegaly, but mumps, as in this patient, is not commonly associated with hepatosplenomegaly, so that crosses out this answer choice here. Mumps also doesn't cause papilledema, which is often a marker of increased intracranial pressure and can be seen in meningitis or encephalitis. Although mumps can present as meningitis, given this patient's denial of headache or neck pain, it is less likely that meningitis is the cause of this patient's illness. Peripheral edema has numerous causes, but infection with the mumps virus is not going to cause significant peripheral edema. In fact, the same judgment and the same insight or reasoning can be used to rule out a systolic ejection murmur as well. The bottom line here is that clinical manifestations of mumps include parotitis, orchitis, and meningitis. Because of the routine MMR vaccine, mumps is relatively uncommon in the United States, although there has been outbreaks in the past few years. Now for question number 2. A 62-year-old man comes to the physician complaining of a skin rash that is extremely painful. A picture of the rash is shown here. A pathology specimen is obtained. Which of the following results would most likely be seen on this biopsy? Would it be A, Mallory bodies, B, Cowdrey A inclusion bodies, C, Auer rods, D, Kollexner bodies, or E, Cabot ring bodies? So first, let's diagnose what this patient has. Looking at the lesion here, as well as listening to his symptoms, including extreme pain, this patient is most likely suffering from herpes zoster. Remember, herpes zoster causes vesicular lesions that follow the distribution of a dermatome unilaterally, as we can see here. This is a classic appearance of herpes and one you may see on the exam. The answer to this question is B. On specimen of a herpes virus infection, Cowdrey A inclusion bodies are seen in these preparations. Cowdrey A bodies are intranuclear eosinophilic inclusions surrounded by a clear halo. But now let's go through the other answer choices and talk a little bit about why they are incorrect. Mallory bodies, or alcoholic hyaline bodies, are accumulations of eosinophilic material in the cytoplasm of damaged hepatic cells. They are commonly found in hepatocytes of patients with alcoholic hepatitis, whose livers would also show cirrhosis and fatty change. They are not seen in patients with herpes zoster infection. Auer rods, as answer choice C, are rod-shaped bodies that are found in myeloid cells. They appear primarily in acute promyelocytic leukemia, the M3 subtype, and are made of fused lysosomes. Care must be taken in treating these patients because remember, a release of Auer rods may lead to disseminated intravascular coagulation. Cabot ring bodies, or answer choice E, are ring-shaped structures found in red blood cells that are found in severe cases of megaloblastic anemia and not in herpes zoster. Exner bodies, or answer choice D, are spaces between the granulosa cells in ovarian follicles that are seen in granulosa cell tumors. The bottom line here is that grouped vesicles on an erythematous base in a dermatomal distribution is a classic description seen in herpes zoster infection. Cowdery type A inclusion bodies can be seen in these sorts of infections on pathologic specimens. Now time for the third question. A 33-year-old woman presents to the clinic after developing an erythematous, finely punctate, blanchable rash. The rash first developed on her trunk and neck. Within a day, it progressed to her extremities, but spares the face. Her tongue initially had white coating, but now it is very red. Physical exam reveals an erythematous oropharynx and paleness around the mouth. Which of the following is most likely the causative organism? The answer to this question is E. This patient's presentation and rash on the tongue is typical of scarlet fever, which is caused by an exotoxin produced by Streptococcus pyogenes. The toxin acts as a superantigen that causes scarlet fever, characterized by a sandpaper rash, strawberry tongue as I just mentioned, beefy red pharynx, and circumoral pallor. As the rash heals, the skin peels off in fine scales. To go over the other answers, Neisseria meningitidis causes bacterial meningitis, which is caused, or characterized, by fever, headache, photophobia, neutral rigidity, and seizures. This patient does not have these symptoms. Rubella presents with a prodrome of malaise and suboccipital or postauricular lymphadenopathy. What gives this away is that there is no rash on the face. In rubella, a rash develops first on the face and then descends to the trunk and resolves in 3 to 5 days. This rash spread is not consistent with rubella, nor are her other symptoms of erythematous pharynx or strawberry tongue. Staph aureus does not cause scarlet fever, although it does produce a toxin that causes toxic shock syndrome. While toxic shock syndrome can result in a rash, it is more diffuse erythema that desquamates, especially involving some palms and soles. It is also accompanied by a myriad of other organ involvement, including vomiting, renal failure, or confusion. Staph epidermidis tends to infect prosthetic devices. It is not known to cause rash that spreads diffusely throughout the body. And that ends the Systems Microbiology section. Please remember to leave feedback on this section so I can continue to improve these lectures as time goes on. Thank you very much, and I hope this was helpful in your studies for Step 1.